First, we're going to start with the manubrium of the sternum. And if you move just laterally, you're going to find a little bump. That's going to be the sternoclavicular joint. If you move along the clavicle to the acromion process and find that little bumpy part on the, like a shelf on your shoulder, that's the acromion process. And just that part where the clavicle meets the acromion process is the acromioclavicular joint. And then this is going to be the sternal end of the clavicle, and this is going to be the acromion end of the clavicle. I'm going to ask my patient to turn around. Okay, so first we're going to want to find the spine of the scapula that goes as a horizontal like ledge on the back, and then you're going to want to move down until you find like about the middle, the inferior angle of the scapula. And if you go up medially from there, that's going to be the medial border. If you go up laterally, that's going to be the lateral border of the scapula. And then, like I said, the spine of the scapula. I'm asking the patient to turn back around. He lifts up his arm. I can feel the head of the humerus about in here and rotating in the glenoid fossa. If I start back up at the acromion process and move down, I'm going to find a little bump. That's going to be the superior, the greater tubercle, and then just below that, inferiorly is going to be the lesser tubercle. Between that is going to be the intertubercular grooves. And then if I move just down inferiorly, there's going to be another bump. That's going to be the deltoid tuberosity. And if I ask my patient to abduct his arm, I can actually feel the deltoid pulling on that. And then back up to where the head of the humerus is, you can feel it kind of narrowing, and that's going to be the neck of the humerus. At the front again, and we find the anterior delt, and just between that and the bicep is going to be the coracobrachialis muscle, and this is responsible for flexion, adduction, and horizontal adduction of the arms. And then I'm going to have my patient flex his arm forward. And that's going to be the anterior delt, and that's responsible for shoulder flexion, abduction, horizontal adduction, and internal rotation. Back down. Now I'm going to have my patient abduct his arm. This is going to be shoulder. This is responsible for shoulder abduction, and this is the lateral deltoid. And then I'm going to ask my patient to extend his arm back. That's going to be the posterior deltoid, and that's responsible for extension, horizontal abduction, external rotation, and shoulder abduction. First, we're going to look at the pectoralis major. So I'm going to ask my patient to push his arms up like he's doing a bench press. Okay, so first up here at the top is going to be the upper fibers of the pectoralis major, and then just below that's going to be the lower fibers of the pectoralis major. The upper fibers are responsible for flexion, horizontal adduction, abduction when the arm is already 90 degrees, and adduction when the arm is below 90 degrees. The lower fibers are going to be responsible for horizontal adduction, extension from a flexed position, and adduction. Next, I'm going to look at the pectoralis major, which is going to be deep to the pectoralis minor, which is deep to the pectoralis major. This is going to be responsible for scapular protraction, downward rotation, and depression of the scapula. Then just below the clavicle is going to be inferiorly is going to be the subclavius muscle, which is going to stabilize and protect the SC joint. It's going to do depression of the scapula as well as abduction or protraction of the scapula. Then we're going to look at the sides of near the ribs is going to be the serratus anterior muscles, which is going to be responsible for upward rotation and scapular protraction or abduction. Next, I'm going to ask my patient to lay on his stomach. First, I'm going to look at the latissimus dorsi, and I'm going to ask my patient to extend his arm backwards. So right when he does that, I can actually feel it contracting. Relax. The latissimus dorsi is responsible for extension of the arms, adduction, internal rotation of the scapula, and horizontal abduction. Next, I'm going to look at the teres minor, and I can find that by finding the inferior edge of the scapula and going laterally, and that's going to be responsible of extension from partially flexed position as well as internal rotation and adduction from an abducted position. And then we're going to look at the trapezius muscle. So there's upper, middle, and lower fibers. So first I'm going to ask my patient to raise his shoulders up to his ears. So I can actually feel that contracting and relax. That's responsible for elevation, upward rotation, and extension and rotation of the head. Then we're going to look at the medial fibers, and I'm going to ask my patient to raise his shoulders to his ears again. I'm going to feel the lower fibers contracting, relax. That's responsible for elevation, upward rotation, protraction, or abduction of the scapula. Then I'm going to look at the lower fibers, and I'm going to ask my patient to push his shoulders down. Pull this way. Perfect. And then I can feel it contracting there. So that's going to be responsible for depression of the scapula, retraction, and adduction, and then upward rotation. And then I'm going to feel for the rhomboids, which is going to be on the outer part of that spine. And I'm going to ask my patient to do retraction of his scapula, which is to bring his shoulder blades together. So I can actually feel that contracting right in the middle here. Relax. So the rhomboids are, their primary movements are adduction and retraction and downward rotation, as well as elevation. Finally, I'm going to look at the levator scapulae, and then I can find that by finding the medial margin of the scapula. So here's the spine, so it's going to be about here. Ask my patient to lift or to do elevation of his scapula, so lift his shoulders up to his ears. So I can feel that contracting right there, and the levator scapula is important for elevation of the medial margin of the scapula.